You're listening to a podcast from Cancer.net. This cancer information website is produced by the American Society of Clinical Oncology, known as ASCO, the world's leading professional organization for doctors that care for people with cancer. In today's podcast, we'll discuss the role of an oncology pharmacist. This podcast will be led by Drs. R. Donald Harvey and John Valgus. Dr. Harvey is the director of the Phase 1 Clinical Trials section at the Winship Cancer Institute of Emory University, an assistant professor in the Department of Hematology Medical Oncology, and the past president of the Hematology Oncology Pharmacy Association. Dr. Valgus is a hematology oncology clinical pharmacist practitioner at the University of North Carolina Hospitals and Clinics, an assistant clinical professor at the UNC Eshelman School of Pharmacy, and a member of the UNC Institute for Pharmacogenomics and Individualized Therapy.
My name is Donald Harvey. I am the director of the Phase 1 Clinical Trials program at the Winship Cancer Institute of Emory University, and I am an oncology pharmacist.
Yes, and I'm John Valgus. I'm a clinical pharmacist practitioner with the Oncology Supportive Care Program at the University of North Carolina Hospitals. I'm also an assistant clinical professor at the UNC Eshelman School of Pharmacy.
Okay, so John, if you could tell the audience a little bit about what you do as an oncology pharmacist and taking care of patients with cancer at UNC.
Yeah, as an oncology pharmacist, I have a number of different roles within the University of North Carolina hospitals. The primary role I serve as is a clinical pharmacist practitioner for our Oncology Supportive Care Program. Basically, our program receives referrals from oncologists throughout the health system for patients who are having problematic symptoms. A lot of our oncologists will view pharmacists as symptom management experts, especially when it comes to side effects of some of the chemotherapy medications they're receiving. When these patients are referred to me, I'll often meet with them in conjunction with their oncologist visits and really be able to spend the time to address whatever symptoms they may be having. Some examples are pain management, neuropathy management. Some patients are suffering from significant nausea and vomiting. And what we do is put together a personalized plan to try and alleviate those symptoms as best as we can. One additional benefit we have in North Carolina is that pharmacists can also serve as providers under the supervision of a physician in collaborative practice agreements. And by doing this, I'm not only able to come up with certain plans that may help patients with their symptoms, but I can also prescribe those medications, which really tends to alleviate some of the time burden of trying to seek people other than myself to write those medication prescriptions. I can also schedule patients to see me in between their oncologist visits if we need to see them more frequently than what they're seeing their oncologist.
And certainly the role of the pharmacist in general has grown a lot over the last 10 to 20 years. Pharmacists do a lot of different roles, and you can certainly see that John is very active in patient care and direct patient care. Many times pharmacists are behind the scenes when it comes to patients' care, yet they're behind the scenes doing very important things like making sure that drugs are prepared correctly, that patients are screened for drug interactions, and that all of the side effects that might happen or have happened with patients are effectively managed. Pharmacists, I would encourage patients with cancer to always ask about their pharmacist, and certainly to ask to speak to a pharmacist if they have questions about their medications, whether it be their chemotherapy or other drugs they might be taking. Pharmacists are growing in number and in roles throughout patient care in cancer. John and I have differing roles. I'm more in a research role, and so I see patients every day on clinical trials of early drugs and drugs early in development. But both of us interact with patients every day, and I believe that that's the best use of pharmacist time, is that of direct interactions. John, what do you ask your patients to do when they come into clinic to see you or to see someone else in terms of their medications?
Well, the first thing I'll often ask them to do is to tell me what exact medications they're taking. A lot of times there's differences between what we may have in our records versus what the patient is actually taking. And I always also encourage them to include in that list not only prescription medications, but also things they're taking over the counter or maybe alternative therapies like herbal therapies. It's important to note that patients can have side effects from these types of medications as well. They could have drug interactions with these types of medications. And I think an important place to start is make sure that I have an accurate medication list so I can see all of the medicines that they're taking. Often after that, we'll get into some of the symptoms that they're suffering from and how that impacts their daily lives, and try and set specific goals for them in terms of achieving things for them personally that maybe by reducing their pain or reducing their nausea, vomiting, that they would be able to do if we were able to prove those symptoms.
And certainly as we think about cancer treatment today and in the next 5 or 10 years, I believe pharmacists are going to become even more important in the care of patients with cancer because we're going to be using a lot more oral therapies, pills and capsules, whereas historically cancer has been treated more with IV medications. I think that opens a lot of possibilities for patients to interact with pharmacists, and certainly in ways that we might not be interacting currently, so more through electronic means, through telephone calls to make sure that any questions that patients have about their medicines can be answered by a pharmacist or other healthcare provider. I think another important role of pharmacists in the healthcare environment is education of other healthcare professionals, nurses, physicians, mid-level providers in the way that drugs work and the side effects that those drugs may have and the best way to manage those side effects. Certainly, there are a lot more drugs to treat cancer today than there were even 2-3 years ago. And with all of that information and all those new drugs, the one discipline that is expected to know about all those drugs is pharmacy. And so pharmacists do have, I think, a specialized body of knowledge compared to other disciplines.
Yeah, Donald, I agree with you, especially your point about the oral cancer therapies. This is something that our pharmacists have started getting a lot more involved with over the last year or so. And it's amazing as I talk with patients how many areas there are to get confused when you're taking these oral cancer medications at home, not heavily supervised like they usually do in infusion centers. I mean, there's issues related to the timing of the medicines, drug interactions with other medications, even to the point of what foods you're taking during the time of taking those cancer medications by mouth. So I agree there is a lot of room for improvement, and I think pharmacists could really hold an important role there.
All right. Anything else, John, that we haven't touched on in these questions?
I would agree with you in the statement that patients should ask for their pharmacists, because I do feel that in a majority of cases they are there somewhere. And one thing that I repeatedly hear from my patients once I start getting involved in their care is, where were you 3 months ago, 4 months ago? I really could have used you. And all they had to do was ask, but a lot of times patients don't even know to ask. And I think that's really important, is that pharmacists are involved as early as possible to try and help patients through whatever medication-related issues they're having.
Mm-hmm. I agree. I think our numbers as a profession aren't as large as those of oncology nurses or oncologists, but at the same time, we're growing in number, and many, many centers have pharmacists that work with them both in academic settings and community settings, and in growing areas of practice like specialty pharmacies. Many of our oral medications come from specialty pharmacies, and so pharmacists are available to patients typically via the phone, but also in other ways, if there are less urgent questions, perhaps email or other items might be addressed to pharmacists. But pharmacists in general work in a very team-oriented environment with nurses and oncologists and patients to try to make sure that all of our patients with cancer have the best therapy possible and that all of their questions and concerns are addressed.
Thank you, Dr. Harvey and Dr. Valgus. More information on the role of an oncology pharmacist can be found at www.cancer.net. Cancer.net is supported by the Conquer Cancer Foundation, which is working to create a world free from the fear of cancer by funding breakthrough research, sharing knowledge with physicians and patients worldwide, and supporting initiatives to ensure that all people have access to high-quality cancer care. Thank you for listening to this Cancer.net podcast.